Good evening. Welcome to Sound Health on Lagos Television. I am Olasunbo Murukpe. It's so good to have you on the program in 2024 again. Today on the program, we are taking a look at how the Nigerian health sector will perform and scale up in the year 2024. My guest is on standby and you'll get to meet her after this break. Please stay tuned.
Looking back at 2023, despite conflicts and challenges across the globe, there are significant triumphs in global health. As we turned 75, we scaled new frontiers in achieving health for all. Here are just a few reasons for hope amidst challenges from 2023. 50 countries achieved elimination of neglected tropical diseases that affect the world's most vulnerable. 3 more countries are now malaria-free. New vaccines are advancing the fight against malaria, meningitis, and dengue. Over 140 countries have introduced the HPV vaccine to eliminate cervical cancer. Safer roads saw global road traffic deaths fall by 5%. And imagine 5.6 billion people, more than half the world's population, are better protected from the deadly threat of tobacco. Health systems are recovering, and world leaders signed new political declarations to prepare for future pandemics, end tuberculosis, and deliver health for all. These are just some of the bright spots amidst a difficult year. Be a part of our journey towards a healthier, safer, and fairer world.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Alera Roberts, consultant public health physician, and she is going to tell us how Nigeria can pivot in the year 24, talking about the health sector. Good evening, Dr. Roberts, and thanks for joining us.
Thank you so much for having me, and a happy new year.
Wish you the same. Okay, the health sector had its highs and lows in year 2023. For you, what were the major factors that formed the highlights or shaped your thoughts in the year?
Definitely, the year 2023 just passed witnessed a lot of challenges with the health sector. We saw the highs in Lagos State, we saw the lows in the rest of the country. Only about 3 or 4 states really performed very well. Lagos State, kudos, we did exceedingly well. However, we were still faced with a lot of challenges, particularly where it concerns the relocation of key members of the health sector to more economically beneficial clients. And when I say members of the health sector, I'm not just talking about doctors. I'm talking about members of the health sector, from cleaners to clinicians, because without every single member of the health sector has a very difficult time with coping. And I think a lot of that was predicated on the inability of the administration, the federal administration at the time, to keep promises that it made. And therefore, people felt disillusioned, disenfranchised, and simply picked up their bags and left. We're struggling with that up till now.
Okay, I'm sure we also had some positives now. Can you please just give some highlights?
Well, there are a lot of factors. I can only speak locally, but definitely, starting from through the life course, strengthening of the immunization program for babies and infants, strengthening of the infant feeding programs, strengthening of mother and newborn child health programs in the states definitely had a lot of positive effects. Also, strengthening of the primary health care delivery system. There has been a lot of work, and people may not even realize how much work has been done. And I must give kudos also to the Lagos State Health Insurance Management Agency, headed by a very good friend of mine. They have done a tremendous amount of work to bring health insurance to every And that is crucial when we're talking about making universal access to healthcare, a reality for every Nigerian and certainly every Lagosian.
Okay, you raised the vaccine coverage as one of our positives now reported in 2023. How do we demystify vaccine awareness? How do we increase coverage as well as achieve the vaccine mandate in year 2024 and beyond?
That is a tremendously important question, and you're going to be shocked at my answer. We need to strengthen primary basic education. Bottom line, that kind of health literacy where people can take informed decisions about their health starts with how you train the child. Train the child up, and in the adulthood, they will not depart from it. That's where I know I got all what I know about maintaining good health started with what I learned in primary school. So we really do need to make a tremendous effort, even more than there has been made before. We've made strides in Lagos State, there's no doubt about it, but I'm a teacher. I'll always say we can do better. So we need to make even more strides in strengthening primary basic education, strengthening the parent-teacher association so that what the children learn in school is translated back home. So that as the children grow, they realize that there's benefit to not only immunization, there's benefit to healthy eating, there's benefit to healthy lifestyles, there's benefit to developing healthy habits. So it's all about health promotion, and there's only so much a health promoter can do going door to door if this information is not strengthened at the primary school level. There's not a lot we're going to achieve in the long run.
Cholera, Lassa fever, diphtheria, anthrax, and some other diseases were reported in Nigeria in 2023. How do we scale up preparedness and response? Because in 2024, we shouldn't be talking about cholera anymore, let alone Lassa fever.
We will continue to talk about cholera, Lassa fever, diphtheria for as long as people are not taking other aspects. Because you see, many of these people forget that the health sector, we will tell you and we will practice the science as we are enabled to. But we are not in charge of water supply. If you have an unhealthy water supply, you will continue to get cholera outbreaks. We're not in charge of people keeping their homes and environments clean. So as long as we have rats running up and down and people doing unhealthy food preparation practices, we're going to have Lassa fever running up and down. We're not in charge of whether parents will agree to immunize their children or not. Therefore, diphtheria will continue to make inroads in whatever gains we think we are making. So these things are going to be around with us for as long as we cannot legislate human behavior. And you very well know, Sumpo, human behavior cannot be legislated. We just have to keep teaching, training, imploring, cajoling, encouraging people to do what is right and listen to the science, get your children immunized, clean up your compounds. We need to implore the powers that be to make sure that there's clean water supply, refuse disposal, areas for safe refuse disposal and safe defecation. We have to stop open defecation. As long as we have open defecation, we're going to continue to have these fecal-oral infections such as cholera.
Okay, let's look at maternal health now. Unfortunately, Nigeria is still on the list of countries that are contributing to maternal death globally. What should we be doing differently now to change the narrative?
Shall I go back again to primary basic education? Making sure girls are enrolled in school and stay in school for the length of time that is needed to make sure they can get to an age where they can take safe decisions about their reproductive health. Let's start with that. Because as long as we continue to have sexual exploitation, teenage pregnancy, girls and women not being able to access safe antenatal care or even safe family planning services, we're going to continue to have maternal deaths, maternal mortality figures going up. Because we see it all too often. Women are brought in, or girls are brought in, young women are brought in at term, when the pregnancy is about to end, when the baby is about to be born. Nobody knows anything about them. We don't know what their baseline blood pressure was. We don't know anything about their anemia levels, their blood levels. We know nothing. No preparations have been made. They are very, very difficult to manage. And a lot of these things are health literacy matters. It's not a matter of Lagos State has the highest ratio of skilled healthcare worker to population ratio that there is for the whole of Nigeria. I'm proud to boast. But there's nothing you can do. I can be in the hospital, 10 of my colleagues, 100 of my colleagues can be in the hospital. If the people do not know to come and where to come, there's nothing we can do about it. We'll be there in the hospital. So it still boils down to health literacy, health awareness, health promotion, which starts at a very early age. Because if girls can stay in school longer, they can take safe decisions as to their reproductive health.
All right. We recorded some...
and boys too.
All right. Okay. We recorded some achievements in health insurance, access to care, universal health coverage in 2023. Now, how do we move or bring more people on board when we talk about public health insurance, reducing out-of-pocket spending?
It's succeeding. It's succeeding. One heart at a time, one soul at a time is succeeding. And I have to give a lot of kudos to our health educators and our health promoters out in the community who go door to door, literally. They know the people in there. I've had the privilege of working with several of them, particularly in the area around where I work. And they are absolutely committed to what they do. They are passionate about what they do. They know the community residents literally by name, how many children they are. And they are so persuasive. I want them to be further empowered to do what they're doing best. That is the truth of the matter. If we have those health educators empowered, the health promoters empowered, we will make even greater strides than you've seen in 2023.
Key players have a lot to do in terms of dotting the I's and crossing the T's now. Let's look at out-of-pocket spending. In US 2023, we saw about 100% price increase in essential medicines, services. What do you think the government must do to address this situation?
That is asking a question for the economists and the financiers. But honestly, if I'm to be very sincere, it was more than 100% increase in the price of goods and services. One of the things we really need to consider is our manufacturing. People forget there is nothing that we use in the health sector that we produce in Nigeria. Hardly anything. Hardly anything. Whether you are talking about infusions, the infusion giving sets, anything that we use in the health sector has to be imported. That requires foreign exchange. So needless to say, we really need to take a long, hard look at how to make manufacturing a possibility and increase the manufacturing of many of these goods and items. And that means looking at the power generation. The cost of power generation is usually what drives up the cost of goods and services. Not that people want to use the misery of others to make money. That is a very wrong notion. In fact, I've listened to so many private practitioners who are thinking of closing down their private health facilities because they simply cannot afford to stay open. They know that the clients they are serving cannot pay those big bills for goods and services. So we need to expand the health insurance. Honestly, I'm very reluctant to say this, but if it can be made mandatory, it needs to be made mandatory. It needs to be mandatory for every Lagos State person, anybody within the borders of Lagos State, to have health insurance. That's the only way it's going to work. Because number one, they will seek help much earlier in the disease process if they knew they didn't have to pay out of pocket. And those initial assessments and good advice and counseling that they will get, which is free to user, free to service provider, will go a long way to stave off the eventual ill health that we see. What we're seeing now is that people are coming in at quarter to dead and expecting miracles to happen. No, it doesn't work like that. So if we can really make the coverage, health insurance coverage of Lagos State total, as in everybody has access to health through health insurance, then the government has the advantage of being able to has the opportunity to take advantage of bulk purchasing. Everybody knows that bulk purchasing means that the prices are lower. I mean, There are simple things, but at least let's start there.
All right, thank you so much, Dr. Alera Roberts. Now, the primary health care plays a cardinal role in maternal care, disease prevention. Unfortunately, this sector of the health system is not given or lack adequate attention now. What must be done differently by key players in the industry?
I will disagree with you a bit on that. The Lagos State Primary Health Care Board has been working very, very hard.
Okay.
Very hard. And even though they are also being attacked by the Japa syndrome, I dare say less than other sectors in the health sector system for Lagos State, because they have worked really hard to ensure that the primary health care clinics are being properly maintained, renovated where necessary, equipped and staffed. They are doing a lot of work. There is a lot more to be done. Don't forget, we are easily the most densely populated state in Nigeria. And we are the pull factor for a lot of other Nigerians coming from other parts of the country. They have a health problem. This is their abroad. Lagos is their overseas. So you find that our healthcare sector is being daily overwhelmed with numbers that it was not designed to treat. Nevertheless, the primary healthcare sector is doing really, really well. However, I have a challenge for Lagosians. If there's a primary healthcare clinic near you, take a picture and address it to the local government chairperson of that local government. And if it is not up to par, call them to account. Because there's only so much government can do if the citizens do not provide counterpart support by calling to account the powers that be. Maybe there's no way the governor, executive governor, can be everywhere, have his eyes everywhere. Not even Madam First Lady, despite her being a physician. There's no way she can be everywhere all at once to see everything that's going on. Once they hear that she's coming, they may just decide to whitewash a few things. But if the citizens will rise up to their own responsibility, pay your taxes, get your health insurance, photograph or comment or complain or hold local governments to account, then it's that two-way connection that will make sure that things work better for all of us. It's a challenge, but I'm hoping in this new year we will all rise to the challenge of partnering with the government to make our lives better.
Absolutely, we are all key players in this field. Now, so let us look at brain drain. Almost all areas you touched refer to the brain drain. You can always refer to it. How do we move from brain drain to brain gain in the health sector?
By enabling the business environment, making it easier to do business. Because I can assure you, if you talk to, let's be conservative, 75% of Nigerians in the diaspora, their hearts are at home. Their parents, their loved ones are at home. The weddings, the wake-keeping, the naming ceremonies, the birthdays, significant birthday parties that they are missing, there's nothing overseas that makes up for that camaraderie. So their hearts are here. If we can make an enabling environment possible, we don't even have to beg them. They will come home in a heartbeat. So that's one thing that we really need to, the administration really needs to ramp up. They've started, but like I said earlier, I'm a teacher. They can do better.
Okay, let's look at budget allocation and implementation now. About 1.33 trillion naira budgetary allocation is for health in year 2024. How much can we achieve with this, and what should take priority now?
Certainly improving working conditions and remuneration for the health sector workers that have chosen to stay back. That is one thing, because you have to retain your staff. We can't even recruit more staff, because the minute they hear the remuneration package, they're like, it's a lie. Don't talk. Is that what? No, I can't do that. So we must improve the remuneration and the working conditions for health sector workers. And like I said, let me emphasize it again. Health sector workers are different from any other category of worker. Whether they are the health sector worker, cleaners, environmental health officers, or the health sector workers, clinicians and consultants. From cleaner to clinician, Health sector needs to be pampered and caressed and corseted, because without health, we have nothing. There's no amount of money you can have in the bank if you can't find the relevant healthcare sector to help you in your point of need. God forbid you have an accident and there are no ambulances because there's no driver to drive the ambulance. It doesn't matter how many sophisticated ambulances the state government has bought. If there are no trained paramedics who can answer the call and get to the site of an accident very quickly and be able to offer that first care, that first hour of care, before even transporting the person to an appropriately equipped and manned health facility. So please, let's not think just doctor. No, cleaners to clinicians, everybody in the health sector. That's the one major thing you can do, that the government can do, to even show resolve and commitment towards improving the situation as we see it today.
All right, partnership was not how would I say now? Partnership was not pursued enough, was not utilized enough in year 2023. Do you think there are reasons for this, and what do you think government can do to benefit from partnership in the health sector?
It's difficult to have partnerships when one party in the partnership is not keeping their promises. Because the partnership depends on two parties coming to a negotiating table, agreeing terms and conditions, and having the trust that the other party will meet the terms and conditions as stipulated. So you cannot come to the table, have an agreement, do a negotiation, have an agreement. One party goes back and starts keeping to the terms and conditions of the agreement, but the other party treats it with levity and disdain. That partnership will quickly break down. And a lot of what happened in 2023, and the health sector wasn't the only sector that suffered. A lot of what happened in 2023 devolved around the government not keeping its promises, saying things that they had no intention of doing. And this was from the national level to the subnational level. It won't work. The next time you call for a partnership, they'll look at it and say, and that's what will happen. So we have to, the government certainly has to take the first step by going back and looking at those promises that they didn't keep and start keeping them. That's the only way you invite the organized private sector and other partners back to the negotiating table.
All right, your call to action. What must be prioritized in the health sector to achieve excellence now in 2024?
Certainly continue strengthening the primary healthcare sector to make universal access to healthcare available and ensure that every Lagosian, in fact every Nigerian if you ask me, gets health insurance so that we can minimize these catastrophic out-of-pocket payments.
All right, thank you so much, Dr. Alera Roberts, for your thoughts and expertise on how to achieve excellence in year 2024 in the health sector. We really appreciate you.
Thank you very much for having me.
Sound Health continues with trending health report from around the world. Please stay. Well, this is where we say thank you on today's episode of Sound Health. Hope you've learned one or two things on this episode. Remember, we are all key players in achieving excellence in the health sector in year 2024 and beyond. For comments and inquiries, or you have topics you would like us to treat, send SMS to 0035 826603 or follow us on social media at TLTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.